Hello everyone, I'm Dr. Ankit Goyal, your psychiatry faculty at PrepLadder. And in this video, I'm going to talk about the strategy for the last 2 weeks before your NEET PG 2023 exam. So without wasting any time, let's begin. The strategy which I'm going to discuss, I call it MAP, that is the map to your goal, where M is the mindset. One of the most important aspects in these days. Firstly, I don't want you to carry any baggage of your past now. I don't want you to worry about thoughts like, I could have done better. Second part in MAP is A, that is action plan. Let's divide the 19 subjects in 2 weeks and make a schedule for these last 14 days. Those who have difficulty in making their schedule can follow this one. For those who want to make their own schedule, I'll tell you some of the rationale behind the schedule. You can apply and modify according to your comfort. So we have an exam on 5th of March. Let's start from 19th February till 4th of March, covering the last 14 days. On 19th February, you can start with pathology. On 20th, you can begin with physiology, and in the last part of the day, you can start with general medicine. On 21st, you can spend the entire day on general medicine. On 22nd, you can cover pharmacology. On 23rd, you can cover microbiology and dermatology. On 24th, you can cover pediatrics and PSM. And on 25th, you can cover biochemistry and psychiatry. So I've clubbed these medicine-oriented subjects together as there may be a lot of overlays, so you don't have to repeat the same topic again. Similarly, in the next week, we have kept surgical-oriented subjects together. You can always decide which group you want to start first between the two groups. So on 26th, you can do obstetrics and gynecology. On 27th, you can spend your time on ophthalmology and forensic medicine. 28th, you can spend the entire day on surgery. While on 1st of March, you can do surgery as well as radiology. On 2nd, you can do orthopedics and anesthesia. While on 3rd, you can combine anatomy and ENT. 4th, that is the day before your exam, I've kept for revising important topics from all the various subjects which are high yielding and stuff which you usually forget, including important images. Try not to keep larger subjects like surgery or medicine in the last 2 days before the exam. Also, for subjects which you feel that you should revise just a few days before your exam, as you tend to forget, let us say biochemistry, you can keep it in the end days. Now, regarding the time schedule, on days when you have 2 subjects, you can split it like 60-40 or 70-30, depending on how much time you think you need for the shorter subject. Regarding MCQs, do at least 30 to 50 MCQs in a day, including all the previous year MCQs and image-based questions. Focus on the next 1 hour. For those who have difficulty in completing grand test, my advice would be try to have at least 1 session in a day wherein you study for 2 to 3 hours at a stretch. This will help in building endurance. Don't give any grand test or any rank related test during these last days before the exams. Let us talk about the last, that is P. It is persistence. Now, some days may have some glitches, may be less productive than other days, but don't give up in these last 2 weeks. These are your 14 days and study for yourself. Please remember, we all forget, which is very natural. So don't be too harsh on yourself if you couldn't remember 1 point or 1 line of a topic. Read it again from your notes. And remember, it's just another exam. You have overcome much more difficult things in your lives. You cannot be afraid of the waves if you want to sail. The one who tries never fail. Lastly, my mantra for all of you, as always, keep smiling, keep moving forward. May God bless you all. Thank you.
Subscribe and press the bell icon so you never miss an update from PrepLadder.